The last part of the swallow screen are the water trials. So, the water trials consist of, we're going to be doing 2 trials of 5 cc's, 5 mLs of liquids, and then we're going to be moving on to bigger amounts. But before you even try the water trials, these things need to be in place. You need to have the patient sitting up at 90 degrees. They should not be drinking out of a straw. They should not be laying down flat. Those things must be in place. Sitting up at the head of the bed, 90 degrees, and no straws. So, the first part, Monica's going to help me out with. Monica's going to be our patient here. And you see I've lined up all these little medicine cups. I wouldn't expect you to pull out 8 of them. 1 of them will do. You'll also have a styrofoam cup. So you'll fill the cup with water. And you're going to be measuring these out as we go. I know this is going to be an extra step, but these are very important steps. And let me emphasize the need, please do not stop if they do fine on these and then you say they're doing fine and we don't need to do these other things. You need to go through these steps. We've measured this out. This is 3 ounces of water. And you at least need to do that much with the patient. When I do swallow evaluations, I do 4 ounces. And most of the time I'm doing much more than 4 ounces. It's really important not to stop. You need to complete the whole thing. You need to push the system, in a sense, push the patient. What you will find is some patients, what we call intermittently aspirate, meaning they get 1 sip down fine, but the next sip is not going down so fine. And you a lot of times will not see that until you start pushing and do more trials. This is also very good. We have some patients that take teeny tiny sips. We have patients that take big gulps. This way, we know they're all measured out. And again, I cannot emphasize enough the importance of going through all of these trials. It is very important not to stop after 1 or 2 and say, it looks good, and they passed. All right, so the first thing we're going to do, Monica, go ahead. This is our 5 cc's. Go ahead and swallow it. Monica, can you say ah? Okay. Some of the things we're looking for with the difficulty swallowing, we're looking for, are they choking? Are they coughing? Those are signs of difficulty swallowing. Do they have a wet vocal quality? I frequently have the patients talk to me when I do the swallow evaluation so I can evaluate their voice quality. Choking, coughing, wet voice. Throat clearing. Monica, can you give me a good throat clear? If you see or hear a lot of that going on, that could be a sign that there are some swallowing problems. So Monica, go ahead. See? So if your patient does this, it looks good on the first one, on the second one she starts coughing, then you know it's time to stop the swallow screen right there. But if those first trials, the 2 trials of 5 mLs looks good, then you're going to go on to the next part of it. And these are 15 mLs. Go ahead. Good. Everything's good, looks good, then we keep going. Oh, we've got problems here, so we're going to stop. One thing you need to look for in the swallow screen, some patients don't cough immediately. Some of them have a delayed cough. So please don't rush this. Don't have them chug a lug and go through them and think that everything's fine. You need to take that time, listen for that delayed cough, especially with our stroke patients, but it can happen with other patients with other medical conditions. They may not feel the aspiration right away, and it might come as a little delay, maybe a minute later or something, but something you need to look out for. Go ahead. And say, ah. Beautiful. All right. Go ahead, keep going. And I know some patients might complain that they're having to drink all this water. Please, reiterate to them the importance of this. We don't want to cause problems, giving them food or liquid when they're not safe for it. So, go ahead. And finally, the last one. Say ah, beautiful. So again, with all of this that she just drank, she drank about 3 ounces of water. We measured this out beforehand. And again, the things that you were looking for on that swallow screen, overt signs of aspiration, you're looking for choking, for coughing, for throat clearing, for a wet, gurgly voice. I'm sorry, Monica cannot simulate a wet, gurgly voice. Most people cannot. But you'll hear it. It sounds like they're underwater or something. Those are those signs and symptoms that you need to be on the lookout for. Or if they're just having a tough time getting it down, if they're having difficulty swallowing, they can't get it down, then you would stop. And let me emphasize the need. Let's just say this is Saturday afternoon when you get your patient and you're doing the swallow screen and they fail it. That's not the end of the road for this patient. Nurses, please, at the beginning of a new shift or maybe 12 hours later, you can redo the swallow screen, you know? Or if the patient, you stopped because the patient wasn't conscious or the patient had slurred speech. But, you know, maybe 12 hours later, they're much more awake, they're much more alert, their speech is clear. Okay, now you can go ahead and redo that swallow screen. So please understand, don't feel that on sometime like a Saturday afternoon you just have to stop and that patient has to be NPO until Monday. These swallow screens can be repeated. Again, I recommend maybe at the change of shift or every 12 hours. Either one of those times would be good to redo it if a patient fails the screen for the first time. So, and that's it for our swallow screen. And thank you for watching.